Hello, my name is Les Fisher, and I'm a director within Emergency Medical Services as a part of Alberta Health Services. Thank you for joining us and for taking the time to view this presentation. It'll give you an overview of emergency medical services and then dive into our provincial EMS service plan. And we will be looking for your thoughts on things as when we get through the end of the presentation. What we'll do is do a quick introduction to EMS, particularly for those who might be less familiar with who we are and what we do. We'll talk about some of the system pressures and the challenges that we've got right now and the things that we are doing to address those. And then we'll take a deeper dive into the provincial EMS service plan, which is really the reason why we're going through this whole engagement process to get your opinions and your perspectives. So let's talk a little bit about EMS. This is a bit of a busy slide, which reflects the busyness of EMS within Alberta. You can see in the upper left-hand corner the resources that we've got, roughly 515 ambulances and other vehicles to respond to events, 5 helicopters, 11 fixed-wing aircraft. In terms of staffing, within the AHS EMS direct delivery services, we've got roughly 3,500 people who respond to calls in our communities. And then through our contracted service partners, we have another 2,400. So a total of 5,900 staff. Those staff respond to about 589,500 events per year. We divide that by the 365 days of the year, we get to the 1,521 requests for service per day. We take that down even farther to give you some perspective of how busy that is. That's one Albertan requesting service from EMS every 53 seconds, 365 days of the year. We do other services as well. We obviously assist with emergency management and disaster response, things like the Fort McMurray wildfires, the floods, the Icefield Parkway crash, the ongoing opioid epidemic, and obviously the COVID-19 pandemic as well. We do that through working, with partners. With partners provincially, as well as through our municipal partners with the police and fire services. And we have a number of our own resources that are also in the communities, and we'll talk a little bit about those here in just a second. So we are ambulances, obviously, but we're much more than that. AHS, EMS, and our contracted service partners together serve over 4 million people in Alberta. We've got 3 communication centers, the Northern Communication Center, Central and Southern Communication Center. We have mobile integrated health, or our community paramedics, who work in the community to help people stay out of hospital. We've got roughly 300 medical first response partners, primarily with the municipal fire departments. There are over 2,000 automatic external defibrillators that are registered with our dispatch centers, so that in the event of an out-of-hospital cardiac arrest, people can be directed to the nearest AED to help resuscitate the patient. We're responsible for medical oversight for EMS in the province. We do that in a number of ways with our medical control protocols and other services that we get with our physicians, including having physicians in our dispatch center. We have a number of specialty teams, our tactical paramedics and our public order teams who are embedded with our police services. We also have the incident response paramedics who have specialties in hazardous substance responses as well as infectious responses. And we have our rapid access paramedics primarily on bicycles for special events to be able to help people out regardless of where they are. I'd like to just explain a little bit about how requests for service get requests for services get coordinated. So when someone calls 911, that goes into a 911 call center or a public safety answering point, a PSAP, and there are a number of those across the province. With the initial questions, the call then gets routed to whoever's going to be most responsible for that incident. It might be for a police event, it might be for a fire event, or it might be for a medical event, in which case it comes to our EMS communication center. From there, we can coordinate with police and fire for co-responses when those are considered to be necessary. So within our dispatch center, they have access to a number of resources to be able to help meet the needs of the caller. So we've got a number of technologies and other operational structures that they can access in terms of knowing where all the ambulances are, what other resources are available, and what sorts of supports might be needed for the call. We've got access to other referral services, such as HealthLink for nursing advice. For bed management and patient flow, we've got access to Rapid. For poison and drug information, we've got access to PADIS. Coordinating our interfacility transfers is also done through the communication center, and that includes access to our fixed wing and helicopter air ambulances and the physicians, the transport physician support that goes along with that. We've got our community programs, the mobile integrated health or community paramedics, as well as the mental health teams that we can access for dealing with mental health challenges within the community. And then we've got our disaster communications as well. So all those things come together and are linked with our provincial or municipal police dispatch, our fire dispatch colleagues, so we can get the best coordinated response to deal with whatever happens for Albertans. Now, with that, it's a brief overview of who we are and what we do. Let's take a look at some of the challenges that we're currently experiencing within EMS. 911 event volume. So we saw when COVID-19 first hit, we saw a bit of a reduction in our 911 event volume. In more recent months, we've seen our 911 event volume go up as much as 30%, and it's been sustained at that over what were our pre-pandemic levels. So, and that's across the province and across all call types. This isn't just pandemic-related calls. So obviously that creates some significant pressure. You know, if you had a 30% increase in any demand for service, that's going to create some pressures. With respect to our interfacility transfer volume, so initially during COVID, when services were being reduced in facilities and what have you, our interfacility transfer volume went down. It's since come back up to the pre-pandemic levels, and we certainly anticipate that once the elective surgeries start getting brought back more fully on stream, that our interfacility transfer volume is anticipated to climb, either stay at pre-pandemic levels or climb above those. Our emergency departments have been a challenge for us in terms of the delays in transferring care of patients. We need to make sure that there's a safe place and staff available to look after our patients before we leave them at an emergency department. And the hospitals are having the same challenges that we are in terms of increased volume, and as we'll get to in just a sec, problems with ensuring full staffing within the emergency departments. So this has been a challenge for us. We've done a number of things to try to mitigate this in terms of working with our colleagues from the emergency departments and from throughout the facilities, because it's really a problem of flow of patients through the entire system. And so no one part of the system can deal with this challenge on their own. Staffing challenges, our staff are tired. I spoke just earlier about the 30% increase in call volume, and that's with the same number of staff who are getting sick, staff who've been injured, either physically or emotionally through the work that we do. And that's created some really real challenges for us in terms of maintaining 100% staffing of our vehicles. And of course, that becomes a real challenge for our staff if we don't have 100% staffing and the call volume is up. That increases their workload. So our staff, no doubt, are getting tired. And as I said, our rates of illness have been seen to be going up. In addition, we've run into some the same issues that other industries have had with the global supply chain. The biggest example of that is with respect to getting our ambulance fleet replaced. Our fleet has travels roughly 23 million kilometers, and we do roughly 1.5 times around the world every day. Our ambulance fleet drives that, and so we need to make sure that we keep our fleet refreshed, and that's been a challenge during the pandemic. The computer chip issue that affects people going out and buying a new car, same issue affects us buying a chassis for ambulances. So that's been a bit of a challenge for us. I think we're starting to turn the corner on that. We've been working closely with GM Canada on some solutions to that, but it has definitely been an issue for us. And then getting parts for repairs has also been a challenge as within our fleet. So what are we doing to address some of these pressures? So there was an announcement back in January from the minister that he'd appointed a provincial advisory committee. It's being chaired by 2 MLAs. There are 5 subcommittees, and through the overall committee and the subcommittees, there are a number of people and groups engaged in that. So we've got our contracted service partners, paramedic unions, obviously elected officials, our Indigenous communities. So a broad range of people brought together to look at some short-term solutions and to make some recommendations to the minister on what can be done to help with some of the system pressures. At the same time, our chief paramedic, Darren Senbeck, announced the AHS EMS 10-point plan. And this is to the things that AHS EMS has already started and others that we're working towards in the future to make sure that we can continue to get to the people who need our services the most as quickly as we can. In addition with this, there was an announcement that they would be going out to for request for proposals for a third-party review of our province-wide dispatch system, and that's out and will be closing in the very near future, and that review will be starting as well. So let's take a look at this 10-point plan and just what's involved in that. So hiring, that's an ongoing activity that we do within AHS EMS to make up for people leaving, people moving to other communities, those sorts of things, and that continues. And we've done a lot of work in the background to try to make this more efficient. Just one small example is when somebody's coming into EMS, we don't do interviews for them anymore in each of the zones that they're applying to. We do one interview and share those results with the other zones to be able to select people. And this is going to become even more an important activity within EMS with the recent budget announcements of increased ambulances availability in the province, 5 additional for Edmonton and Calgary as examples in each of the next 2 years. The non-emergency interfacility transfers. So we've just concluded a pilot at the Peter Lougheed and started a pilot in the North Zone using an algorithm to identify which patients may not need EMS response for a transfer. That could go either by family or by a continuing care home shuttle bus or taxi. For example, if somebody is being discharged from hospital going to a continuing care home and they have no medical needs in terms of medical supervision, that care home could send their shuttle bus over to pick them up and take them to the facility rather than tying up an ambulance for them. So that's underway. The pilot is underway in the north. And we're working with Calgary Zone to do a broader rollout of it across the Calgary Zone, and then we'll be looking provincially for a rollout. Fatigue management. This deals with the hours of work, particularly for those communities where people worked some set hours at the hall or the station and respond to the calls, and then we're on call for other hours. And some of those that were busier got into too close to their maximum allowable work. And so we're working with our contracted service providers and some of our direct delivery sites to change that model to make sure that we reduce the number of times that ambulances are being booked out of service due to fatigue. Transferring some of our low priority 911 calls. So not every call that comes into our communication centers requires an ambulance. And so we are moving some of those calls that don't need us right away through to things like the PADIS, through to HealthLink 811, and doing that in consultation with the physicians that we have in the dispatch centers. In terms of our motor vehicle collision response, where it's clear that there is no patient, nobody's been injured, we've stopped the automatic dispatch of an ambulance to those events, recognizing that police and in many cases fire services will also be responding. And if something happens that somebody does need to be transferred, they can provide that immediate level of care and then call for an ambulance to take over the patient. In Calgary, we're working towards implementing an integrated operations center similar to what is already in place in Edmonton. And this brings together the leadership teams from the facilities and EMS so that we can plan the patient flow through the entire system. In many cases, it helps with getting the ambulances out of the emergency departments in a more timely manner. And it also emphasizes our role in the interfacility transfer side of moving people through the system so that there's some place for the patients who are in emergency to go into one of the beds in another part of the hospital. So that work is underway. Our urban response plan. So we've heard loud and clear from some of the communities that border our larger metropolitan areas about the concerns of those suburban rural ambulances being utilized at too high a rate within the metro centers. And so we've adjusted it so that the dispatch staff in the communication center can take a look at that call and say, is that, do we need to assign that to one of the suburban rural ambulances, or can it wait until one of the metro ambulances is available? And that's already underway, and it's already showing marked improvement in terms of the availability of our suburban rural ambulances in their home communities. Preempt and divert, that allows the dispatch staff again to take a look at what all the ambulances are doing and the relative priorities of calls. And then if somebody's going to a lower acuity call, to be able to divert them from that onto a higher priority call. In terms of the Red Deer interfacility transfer, we're currently modeling what it will look like to have some dedicated interfacility transfer resources for that very busy corridors around Red Deer to be able to take the bulk of the interfacility transfer work, again, to make sure that the other ambulances are available within their communities in that corridor. And then finally, the provincial EMS plan was the 10th point in here, and that's what we're going to dive into now. So let's take a look at what we mean by this provincial EMS service plan. So the previous Minister of Health had directed AHS EMS to come up with a long-term service plan for EMS, for all of EMS in the province, including all emergency health services. And keeping in mind that EMS is integrated within the Alberta health system. So not looking at revisiting that decision. And then coming up with a 5-year vision and direction for EMS in Alberta, as well as a clear plan to get there. And the timeline for making this plan is no later than September 30th, coming up here in 2022. And this plan and the planning process that we go through to get to the plan will provide the context that we need for those regular day-to-day business decisions that are made within AHS EMS. So what exactly is service planning? Well, it's a process that looks at where we are in terms of service delivery, and that's what the stage that we're at right now. Then it identifies and prioritizes recommendations and initiatives and describes a sustainable model of where the service needs to grow and change to meet the current and future needs of Albertans. So there's a lot of background information that needs to be gathered in order to make these sorts of long-term plans. And then the plan needs to recommend how to schedule the growth or improvements and changes that happen, since we recognize that they can't all be done at once. So we're at the first stage of this in terms of getting a solid understanding of our current state. So just to put it in context of other documents that you may have seen or heard about, obviously we get our direction. All public services get their core direction from government policy and the priorities that government sets. That then informs the Alberta Health Services health and business plan, and that's the overarching strategic document for all of Alberta Health Services. So that for the delivery of all health services within within Alberta, and we will make sure that everything that happens within the EMS provincial service plan feeds into and supports the overarching AHS health plan and business plan. So then from there within EMS, and this is all EMS in the province, we will have our provincial service plan. Flowing from that, we will develop annual operating plans that will say how we will accomplish the tasks that we need to do this year to feed into our overall 5-year plan. And then there's the ongoing monitoring and reporting to provide those timely updates on progress towards the goals and objectives from the annual operating plan and the 5-year EMS service plan. So we will be following a bit of an improvement cycle in this. We'll have the service plan. We'll implement that. We'll monitor and see how we're going, and then make adjustments as we go every year within the annual operating plans to make sure that we get to the end state that we want to be at the end of 5 years, and that'll start another cycle of planning and updating to make sure that it's still relevant. So as I said, the service plan will provide strategic direction to all of EMS, both the direct delivery and the contracted service partners. It will align with the quadruple aim of the AHS health and business plan. So that's improving the experiences of patients and families, improving patient and population health outcomes, improving the experience and safety of our people, and improving financial health and value for money. So that's the quadruple aim within the AHS health plan and business plan. We'll establish some principles and overarching goals to help guide those decisions that need to be made on a day-to-day, week-to-week basis. And as I've said, it'll be a living document that'll be reviewed and refreshed in the future to make sure that EMS within Alberta stays on the leading edge of what we need to be doing. So overall, the service plan needs to be aspirational. We want to think big, we want to think positive, we want to be the best that we can be. It also needs to be realistic and financially responsible. And I don't think that those are mutually exclusive attributes of a plan. I think we can still be aspirational and also realistic in terms of how we phase it in, and fiscally responsible as public servants, being responsible to our taxpayers. So things that are in scope here, optimizing the patient, family, and practitioner experience is going to be key, and that's why we're here right now to gather your perspectives. Needs to support that frontline delivery of not only safe patient care, but also culturally safe care, and having our paramedics work to their full scope of practice. We need to be integrated across the entire system of care. So what we're doing can't be done in isolation. We need to do it in cooperation with the rest of the healthcare system. And we need to make sure that the system is sustainable in terms of our cost, in terms of our workforce planning, and other elements of being sustainable. And there needs to be equity across urban and rural parts of our province. Things that are out of scope are things like our negotiations with the unions, negotiations with the contracted service partners. Those are the sorts of things that might happen as a result of the plan, but they're not within the scope of the overall planning. And there's a number of decisions that have previously been made that aren't going to be revisited as part of this planning process. So things like the helicopter EMS review, the decisions on our dispatch model, and the decision to integrate EMS into healthcare. So let's take a look at the process. So right now we're assessing our current state. We have generated some awareness, that's why you're here, and we're inviting you to participate in the assessment of our current state. We'll do a survey that we'll talk about briefly, and we're doing a number of other engagement sessions with different populations. From that, we'll get a large amount of data that we will then need to distill down and identify some main themes of what we've heard about our current state. Now, with our current state, we want to know what's working, because if there are some things that are working well, we don't want to change that. We don't want to mess things up if they're working well. We also want to know where we need to improve, and what sorts of things might be happening in the future that either might pose a challenge for us, or that we might be able to take advantage of. So those are all going to be elements of our current state. As I said, we'll get some themes, and then we'll be going out to a body of experts to take a look at those themes and help determine the priorities for our future plan. That'll then feed into our planning for the future. So depending on what those themes are, we'll get working groups together who have the expertise to come up with future plans for each of those themes. Within that, we'll be looking again for some engagement from the public and other experts on additional information and feedback on the plans. And that'll help us identify our overall goals and actions within the service plan. From there, we will draft the plan and look to get the approvals through Alberta Health Services, through our executive leadership team, and then through the ministry as well. We'll get it over because we are doing all of this with the full involvement of our partners at Alberta Health, and so we'll need to make sure that everybody there is on board with the draft plan as well. And then finally, it'll be go to the minister for approval sometime before September 30th of this year. So now we come to how you can participate. Once you're done watching this presentation, you go back to the Together for Health page. There'll be a link there to a current state survey. And we encourage you to go in and answer that, that survey and really let us know your perspectives on, as I said, what's going well, where we need to improve, and what sorts of things are coming down in the future that we can either take advantage of or may create a challenge for us. All of this, it will be housed on the Together for Health page, and you can see the link there, which obviously you've had to be able to get here. But if you could bookmark that so that you can come back and follow up for updates, there's a spot there where you can ask questions, you can provide feedback on the surveys, and just keep updated on when there might be an opportunity for you to engage again and to see where we are in moving through this overall process. Because in the future, when we come up with our draft plan, there are areas that we may want to get some more engagement with everybody to see, are we on the right track? This is what we heard. This is what the working group said we should be doing. What do you think about that? So there'll be opportunities for that ongoing engagement, and it really is important, since this plan is to serve all Albertans. We need that input from all Albertans to make sure that we're on the right track to providing the services that people need and would like. So thank you again for taking the time to watch this presentation. Encourage you, as soon as we're done, to go back to the Together for Health page and be sure to fill out that survey and share this information and the links to others that you know who might also be interested in finding out a little bit more about EMS and providing your input on the future of EMS in Alberta. Thank you.